A cyber attack. One of the nation's largest healthcare companies, the target continues to have a ripple effect for folks here in our area. Good evening. Thanks for joining us. I'm Sarah Diamond.
And I'm Casey Marler. Last month, a cyber attack hit a subsidiary of United Healthcare. Millions lost access to life-saving medicine at the pharmacy. Local pharmacist says almost a month later, there are still problems.
So we don't know the patient's copays. We don't know if a medication's covered from 1 month to the next, if a patient's copay is changed. And especially with high deductible plans in today's day and age, and it being closer to the first of the year, anything could change at any moment.
News Channel 11's Clarice Shaley found out how some in Northeast Tennessee are dealing with the struggle.
I spoke with a man who tells me he has to pay hundreds of dollars more out of pocket for his life-saving medication. You take this pretty regularly?
Daily. It's an important medicine.
James Swinehart has COPD and learned about the cyber attack when he went to get his prescription. He has this coupon that helps bring down the cost of his originally $600 prescription to no payment at all.
And they can't put that in their computers either. So it's either the cash or you can't get the medicine.
Mooney's Pharmacy may help you.
The pharmacist in charge at Mooney's Pharmacy, Chris Lopez, has been working with customers to solve this issue and is taking a chance on loyalty.
We can look back and say, okay, this is what the patient paid last month. They've paid this for 2 to 3 consecutive months. We're going to go and let the patient have this in good faith with this insurance company. We're going to hope they get this fixed.
Rebecca Wagers is a leader with the Community Pharmacy Enhanced Service Network, or CPESN, which is a network of pharmacies. She works with pharmacies and recommends they reach out to doctors' offices for samples of prescriptions for patients who may be or are dependent on coupons.
And really just to make sure that you're staying on top of those patients, to make sure that that they're not suffering any unnecessary side effects from not having access to any medications they otherwise would have.
Wagers says many in our community can't afford to pay out of pocket for the full price of medication.
I work, I have money, I have options. You know, there's people less fortunate, and that's who I'm concerned about. You know, they're walking away from life-saving medicine the way I see it, and you know, that ends badly.
Lopez tells me some of his patients are being asked to pay thousands of dollars out of pocket for their medications now. Wagers says there's no indication on when the system will be back up and running.
Clarice, thanks. Also this afternoon, the U.S. Department of Health and Human Services launched an investigation into United Healthcare and their subsidiaries. HHS says the cyber attack has disrupted healthcare billing and poses a direct threat to patient care. The investigation will look specifically into the law as it applies to HIPAA privacy and security breach rules and if they were broken.